for our next panel, we're going to be talking about improving food access in community settings. So we're going to have Gherell Owens, or Gio, join us as he's with Community Connections New York City. Gladys Roman, the Executive Director of Manna of Life Ministries, and Ribka, sorry, I might butcher your last name, Ribka Getachew, Director of the New York Good Food Purchasing Program campaign at Community Food Advocates. And we're going to be talking today about these are different, we have food pantries and we have other settings and communities where food is provided to the community through government funding. And so we're going to be talking about ways to improve access to the healthier foods through these different programs. And so if we can start, if we can have Gio provide us with some background information about emergency food programs that are funded primarily through the Farm Bill and that fund the food pantries, just to give us some background.
Yes, thank you. Good morning. So the majority of the pantries within the 5 boroughs receive some type of government funding, whether it's TFAP, which comes from the federal government via USDA, or HIPNAP, which is a state grant, or what used to and kind of sort of still is called EFAP, but is now mostly known as Community Food Connection, which is a city-based grant. All of these different commodities are available to pantries that are open to the public and have minimal restrictions on who can come and whatnot. So one of the things that has been a trend in recent years is community members, and so by virtue of them, pantries, looking for more of fresh produce, fresh lean meats or frozen meats, other kinds of lean protein and low-fat dairy, and also whole grains. So as over the years, client choice has become more popular, pantries are able to kind of see a little bit better what are the foods that people are really interested in, what are the things that they are of their own volition deciding to take. Another one would also be culturally appropriate food. So one of the common issues in this area is that the majority of the pantries struggle to have access to fresh produce, but when they do get it, they get what is kind of known as like the hard 7, which I feel is probably really more like 10 or 11, but it's basically kind of like root-based stuff. Things like potatoes, beets, rutabagas, onions, sometimes apples and things are mixed in there, but it's a lot of like hard vegetables, which people like, in which they do want and eat, to an extent, but it's balanced and not much variety in terms of having access to different nutrients and things along those lines. So people are looking for leafy greens like collards in particular, and things along those lines. So I'll pause there.
Thanks, Gio. And so Gio actually does some consulting work with Bronx Health Reach and provides some technical assistance to our food pantries in adopting the Healthy Pantry Initiative. And so this is about adopting client choice, promoting the healthier options to the food pantry clients. And one of the food pantries that participates in this program is Manna of Life Ministries. And so we've asked Gladys to join us and tell us about her experience working with this program. Gladys?
Yes, good morning. I just want to apologize for being off camera because I am at the pantry. We opened at 7 a.m. The line's been around the block and still around the block. The demand for food and the number of people coming in weekly has grown and grown and grown. But I want to say that I'm grateful that today we received a really good, the last few weeks we've gotten great deliveries from the food bank. So I'm just going to give you an idea of what we got from the food bank yesterday and what we're able to share. So we have, today we're giving out beans, we're giving out walnuts, frozen strawberries, wild caught salmon, chicken, pulled pork, in addition to pantry bags, in addition to giving out some of those green leafy vegetables that Gio mentioned. We do give out some of those hard vegetables, but we try to focus also on giving out the healthier, the greens, the kale, the bok choy, and the eggplants, all of that stuff. So today, you know, because we have so much food, the line is long, it takes a little longer. The staff is exhausted because they're mostly seniors like myself, but we're getting it done. Bronx Health Reach has really helped us in really focusing on helping the folks to eat better. First of all, by being able to give them cooking demos. So in the past, when we first started and we started getting some fresh vegetables like the kale and the collards, a lot of the folks didn't want to take them because they were afraid, they didn't know what to do with them. And as we've had the cooking demos and we've been able to show the community and share recipes, now we have zero problem in giving out any of those vegetables. The clients want them. The clients have talked about how they are able to cook these and share with their neighbors. And we see a real positive outcome, being that we're able to give out more fresh vegetables. Now, after COVID, there were a lot of grants and we were getting many vegetables and fruits that we were able to share. Now, this is a good week, but we have weeks where we don't have as much. And so at that time, I have to ration what we have so that I can make sure that everyone gets some. And we do the client choice with the vegetables and the fruits so that we make sure that there's no waste. Because giving people just a bag of food without having them be involved just sometimes doesn't work. We have seen in the past, sometimes people put even the food in the garbage. I hate to say, but that's just a small fraction. I don't want to focus on that. But we're focusing now on really just educating the community. Even, you know, sometimes we get things from food bank that are not as popular and that are harder to sell, but with the cooking demos, we're able to show them how to take those foods and to do the best they can with what they've got. I'll give you an example. We were getting many cans of cooked chicken. And so the chef taught the community how to make chicken nuggets with the cooked chicken. And it doesn't sound so great to some, but I can assure you that when she took that cooked chicken and cooked them up in olive oil and made these little patties, it was great. The cooking classes are very busy. As a matter of fact, we may have to cap it because it's just so many people coming. We see that the community wants these fruits and vegetables. They want them. Once you teach them, they request them, they give you feedback. We hear of so many folks who have illnesses that can be prevented through diet that really have a direct correlation with what they're eating. We hear of so many young folks passing away. We hear of people just because the community is close to us and because we interact with them as much as we can, we get to hear the stories of premature death, and so often how it has to do with not having access to the right foods. So we are grateful to Bronx Health Reach. We're grateful to Gio for helping us along the way, and I'm glad that today we have lots of food to share.
Thanks, Gladys.
Thank you.
Yeah, it's really exciting to see how you're able to promote the healthier foods. And it's true, you know, community members do want the healthier foods, so we need to make sure that they're available and accessible and people know what to do with them too. So the way that we're getting food into communities, right? Like food pantries is one way of doing that. We also want to talk a little bit about procurement, and Ribka's here to talk to us about that. And that's this program, the Good Food Purchasing Program, where it helps to incentivize government agencies to provide healthier food and, you know, food that meets different value categories into the communities. So Ribka, if you want to give us some background information, then we can have a conversation about, you know, ways that we can improve this procurement through policy changes.
Yeah, absolutely. Thanks for having me here, everyone. Thanks for inviting me to this conversation. I've been on since 9 a.m. and all of the conversations have been just so rich. I'm going to just jump in with some slides if that's okay now. I'm going to just share my screen here. Are you able to see it? Okay.
Yep.
Yes.
Okay, it's not covered by anything.
Nope.
Okay, great. So we're going to be talking a little bit, like Kelly mentioned, about how we get food from farm to the public plate here in New York City and New York State. And we're going to be exploring this through the lens of the Good Food Purchasing Program. This is just a very quick snapshot of who we are at Community Food Advocates. I should have introduced myself. My name is Ribka Getachew, Director of the New York Good Food Purchasing Program campaign here at Community Food Advocates. We're a New York City-based organization, and we lead all of our work through the lens of our wonderful coalitions. We have a number of wonderful initiatives that many of you might be interested in, one of which you're going to hear a lot about today, our Good Food Purchasing Program campaign. A lot of folks in New York City know us for our Lunch for Learning campaign, which advocated for several years to win universal free school meals in New York City. We have in our school our food and youth food leadership program here at Community Food Advocates, a growing supermarket access food and gentrification project, and a number of other campaigns that have emerged from our work since our inception. So the Good Food Purchasing Program was actually created by the Center for Good Food Purchasing, which is a national organization, and it was specifically created to offer resources to local governments, community groups, and public agencies to truly figure out how to best leverage the power of the public dollar to create a transparent and equitable food system that ultimately prioritizes the health and the well-being of our people in our communities, our animals, and our environment. The Good Food Purchasing Program, or you might hear me say GFPP throughout this presentation, is the first procurement model actually in our country to support these 5 different food systems values in equal measure. It transforms the way ultimately that public institutions purchase food by creating this transparent food system that's built on these 5 different value areas: local economies, animal welfare, environmental sustainability, nutrition, and valued workforce. And the central question that we really find ourselves asking is, how can responsible food procurement within city and state agencies help to build a more resilient food system that's ultimately reflective of the values that the communities that these institutions and agencies are serving? When we talk about leveraging food procurement or the power of food procurement, we're saying that because large public agencies spend so much money on food, these food-related companies that they work with, from the producers, the farmers, the processors, and distributors, they become reliant on business from these agencies. And so knowing this from a simple supply-demand perspective, we know that agencies can ultimately influence those food companies to adhere with practices that are in line with the agency's priorities. Now, an agency can decide to, prioritize low prices or specific values like community health, worker well-being, or racial equity. We know ultimately that an agency can also threaten to withdraw their business from a company if those companies are not in compliance with the agency's priorities. And thankfully, and you'll hear me talk about this a little bit later, New York City has already committed to the Good Food Purchasing Program. It's been a few years now since it's happened. You'll hear me speak a little bit about how that's unfolded here in New York City. And ultimately, though, we want to know how this happens, and that's one of the main questions that we're asked. The Good Food Purchasing Program, if I were to just whittle it down, it on one hand holds large vendors accountable to better practices, while also ensuring that small and historically marginalized vendors like Black, Indigenous, and POC farmers and food producers have more opportunities to contract with our public agencies. If we're just to get slightly more technical, the Good Food Purchasing Program itself is a really robust and flexible framework that's built on a scoring system, kind of like a report card, where agencies and public institutions are essentially scored based on how well they meet or align with the values that make up the Good Food Purchasing Program. Those institutions and agencies might not have ever had to make these sort of shifts in the way that they purchase food. So they're provided with a comprehensive set of tools and technical assistance and a variety of resources to support that shift towards a values-based food procurement model. This slide here shows in slightly more detail the 5 different value areas that make up the Good Food Purchasing Program, from nutrition and environmental sustainability to valued workforce or labor, to local economies and animal welfare. I know that this is being recorded, and I'm happy to also share these slides after, but on this particular slide, there are little images that you'll see right next to the different words, and you're able to click those for more details, and I'm happy to share them in the chat separately too, if that'd be more seamless. So one of the questions we're also asked is how this program works, and this is radically simplifying the program. But if we want transparency and accountability in our food system, we also have to make shifts to support, we have to make shifts within our marketplace to support food system transformation. And part of how that starts to happen is we have to understand where our food purchasing is happening currently. Where are our food dollars going? Where are our public taxpayers' dollars going? And so institutions are asked to assess a baseline. They give all of their procurement data. It tells us where our food is coming from. And then that institution then sets goals and develops strategies to then create the shifts that they want to see within their food system. They then track progress on an annual basis, oftentimes more frequently than that, oftentimes on a quarterly basis, to ensure that they're reaching those goals. And of course, celebrating success is also tremendous and an important part of the puzzle. I just wanted to take a quick step back, considering the context of this food summit today. I just wanted to give a sense of how much money is being spent nationally in the institutional food service space. Just to clarify, when I say institutional food service space or the institutional marketplace, I'm talking about any public institution that uses public dollars to purchase and to disseminate food to the communities that they're serving. So that could be anywhere from our schools to our public pantries, to our hospitals, our senior centers, our jails. And that's what these dollars, and that's what this particular program is speaking to. One of the latest figures that we have for our national institutional food spend is from 2017. And just to give a snapshot, that number has probably slightly changed since then. But just to give a sense of what amount we're talking about $120 billion a year, which is tremendous. You know, this number is massive, and it really does showcase that we have an opportunity to align our enormous purchasing power with a values-based approach. Now, like I mentioned earlier, the Good Food Purchasing Program is a national program, and I wanted to just share this map and share this scope before I get into New York City and New York State, just to share a little bit about what conversation we're a part of here in New York City as a city that has committed to the Good Food Purchasing Program. In 63 institutions across the country, those institutions have begun creating that shift towards a values-based food system approach, which is massive. Those 63 institutions cover about 25 cities. So we're acting in concert with a good chunk of the United States. Collectively, the Good Food Purchasing program has actually impacted over $1 billion in food spend. So we have a tremendous ability to impact our food system just using the institutions that have already committed. But just thinking back to that 2017 figure, knowing that we spend over $120 billion annually across the country, we have a lot more potential to go. Now, I put this resource here. I won't speak about it too much, but I'll also share it in the chat a little bit later. But it was developed, this Impact Hub was developed in 2021 by the Center for Good Food Purchasing. And it's a resource that actually functions as a calculator that institutions and communities can use to input their respective population and see what impact their respective food procurement shifts might make on the larger food system. So you might add in your population and see what increase of wages you might have by certain changes to the way that you integrate valued workforce or labor metrics into your food procurement practices. I'm happy to also, I have my contact information at the end of this presentation, so happy to talk through that with anybody since we didn't go through it. All right, so getting to New York City. In New York City, just to give a little bit of that sense of how much we're spending and how many meals are being served, we're spending quite a bit of money. We're spending over $300 million annually a year across 11 institutions, serving about 230 million meals annually. Vast majority of that comes from the Department of Education. They have they've been undergoing quite a journey because they were one of our earliest champions here in New York City for the Good Food Purchasing program. But they also are challenged by the fact that they have to serve food for 1.1 million students a day. So they're tasked with a tremendous goal here in New York City and have been really leading the way. But New York City really committed to the Good Food Purchasing program in 2018, which ultimately meant that the city began assessing what their food spend was and how well aligned our agency's purchasing was with the Good Food Purchasing program, which then led them to strategizing on how to shift their food procurement processes to better align with the Good Food Purchasing program. Like I'd mentioned, the earliest champions in New York City were our Department of Education and Health and Hospitals, who set the tone for how we here in New York City can maximize values-based food purchasing. In 2022, our coalition also worked with the mayor's office to get signed an executive order, specifically Executive Order number 8, which significantly updated the New York City food standards by integrating GFPP provisions within them, and also more deeply committed the city to the Good Food Purchasing program. We also know that Executive Order...
Sorry, if you could just wrap up soon. We want to move on to Q&A soon. Thanks.
Okay, great. So New York City also introduced a Good Food Purchasing bill in 2019, and it was only introduced. The reason why it's actually not yet been able to pass is because of the tremendous restrictions in New York state law, which I'll get into in just a second, but New York State has some of the most restrictive procurement law. It ultimately requires that New York City and municipal level agencies across the state have to select the lowest bidder. And so what we're doing is ultimately introducing what's called the Good Food Purchasing the Good Food NY bill, and I'll skip this slide just to speak to that very quickly. But ultimately, the Good Food NY bill allows for a bid to be awarded to a qualified vendor who fulfills one or more of the values-based criteria that are written out in the bill that aligns with those 5 different value areas. So in this instance, once passed, and we're hoping for it to be passed next year, successful contracts would actually be given preference over those lowest bidders, so long as their bid is within 10% of the lowest responsible bidder's bid, and so long as they meet one or more of the values that ultimately make up the Good Food Purchasing Program. But we ultimately also need to know where this food is coming from. And so we integrated a transparency provision, which requires that all suppliers, all food vendors would be required to submit in their bid their relevant supply chain data, which includes things like their names and addresses, so that we actually can know that we can have more clarity on that trajectory from the farm to our public plate. And I'll pass it over back over to you, Kelly.
Thanks, Ribka. Yeah, so if anybody wants to start putting some questions in the chat, I just want to get started because as I was doing research for this summit, I found this particular bill that looked really interesting that could impact both the food pantries as well as many other community sites, called the Fresh Produce Procurement Reform Act, which would, it would direct the USDA to work with existing growers and fresh produce distributors to purchase, pack, and deliver fresh fruits and vegetables to local food banks, schools, youth serving organizations, tribal governments, and other nonprofit community members serving nutrition insecure populations. And this would allow for a wider variety of US grown fresh fruits and vegetables than is currently available through these programs. And most importantly, I think, is that the USDA would consider values other than lowest cost bidding in awarding contracts, providing opportunities for a wider variety of high quality produce, sourced, packed, and distributed from growers and distributors, including veteran, women-owned, and socially disadvantaged members of the agricultural community. So I think that this is very much aligned with the Good Food Purchasing Program and can also provide more fresh food in food pantries and other community settings as well. So I know we didn't really have a chance to get to the logistics of how this particular legislation might coincide and align with the work already happening in New York City and New York State. But I just wanted to bring it up because I think it's relevant to the conversation. And so we do have a couple of minutes for questions if anybody has any related to getting healthier food into community settings. Otherwise, if any of the panelists want to comment on the legislation I just mentioned.
I just want to say that I love this Good Food Purchasing Program, and it's just so needed. In the past, I would have to check the produce of each and every box when it came in, because when we first started getting a lot of the produce, they would send us, certain companies would send us the bad stuff. They would send us stuff that was potatoes that were rotten, carrots that were soggy, and just it was like they had absolutely no respect for us and the food that they were sending us. So the only way that I was able to change that was by taking photos, calling, and making sure that they were not going to do that. But it made me wonder about the other pantries that didn't have a chance to do that. And sometimes folks who work in pantries kind of feel like we shouldn't complain because we're given this food and we should just take it and be grateful. But in fact, somebody's paying for this food, and we deserve the same food that the people in the Hamptons get. We don't deserve any food that's any less quality than the best food that's available. So I think this is just so very much needed. And I would really, really love for the other pantries, because I see sometimes the food that they give, and I see that they're accepting things that shouldn't be accepted. And just to put pressure on the vendors and make sure that they provide the right stuff for us, let them know that we're watching them and that they're required to give us good quality food. So thank you so much for that presentation. Thank you.
Thank you, Gladys. I appreciate that.
Thanks, Gladys.
Also, Kelly, I'd like to add the significance of the community garden that Man of Life has, and that also we've been able to implement at a couple of other sites that do HPI with Bronx Health Reach. So some of the sites, through partnerships with Grow NYC and the Bronx Botanical Gardens, were able to receive some of the supplies, including like the wood for the beds, the soil, startup seeds, in order to start community gardens, which were produce food that was used not only in pantry given out to people, but also in recipes that are used in the cooking demos. So just really kind of like, one, giving people the freshest food possible, like literally, but also being able to kind of make that connection in nutrition and helping people to kind of change their eating habits and their behaviors.
Yeah, thanks, Gio. I see a question in the chat from Tazy about the history of why New York State is so restrictive and one of only 2 states that requires the lowest bidder. Ribka, do you know that briefly?
Yeah, I can touch on that, Tazy. Thanks for that question. A great question. They have New York State and Illinois has one of the most restrictive structuring of their procurement law. Other states also have similar provisions, though have a little more flexibility. The reason why it's not clear exactly why New York State and Illinois stand out from the bunch, though oftentimes New York City and New York State chooses to do things quite differently. But the reason why the law was structured in this way is to actually prevent corruption, because a lot of what was easily happening was that friends who owned businesses were getting contracts from public agencies. And so the reason why this was built into our law was to prevent that corruption and to ensure that there were stop guards and some sort of economic safeguards to ensure that that there was some intentionality about where public dollars were going. And so what has happened since that was integrated into our law decades ago is that there was some best value language, and even our lowest bidder language is coupled with lowest responsible bidder. So it isn't entirely economic. There are some specifications that our vendors currently, of course, have to meet, and then the different agencies, of course, have their different standards that they have to meet. And in New York City, specifically, we have very strong New York City food standards that our agencies also have to show compliance with. But in short, the reason was to prevent corruption. And so what we're trying to do with our law, with the Good Food NY bill, rather, that we've introduced 2 years ago, and that we're hoping will pass in the upcoming legislative session, which starts in January, is to create another set of options for public institutions to select their vendors. While remaining conscientious of their food budgets, they would have a little bit more flexibility to select suppliers and food vendors based on the values that I spoke about earlier today.
Thanks, Ribka. Okay, we are coming up. This is going to be our last question, and then we're going to try to take a couple-minute break before 10:55. So Brett, if you have a really quick question, I see your hand raised.
Yeah, thank you. Thank you, Kelly. Just want to say real quick, let's not forget the mental health side of this food challenge that we're going through. A lot of people who are dealing with severe mental health challenges they don't even care what they're eating. They're eating food as comfort food to help them to suppress the emotions of what they're going through. So while we are promoting healthy eating and healthy food, we also have to understand, because it gets very frustrating when someone is experiencing a mental health crisis, to be told to eat properly, or the fact that the reason why they're having a mental health crisis is because they cannot afford the food that they need to eat. And sometimes when they're being thrown these things, and I'm glad Gladys said what she said, it's sometimes you're already struggling with your challenges and someone is going to give you something and you're supposed to be grateful for it just because it's being given to you, does not inspire someone or help someone come out of depression or anxiety or the fear that they're going in. So let's remember to keep the mental health focused and the impacts of mental health on people who are struggling with food as well as the other challenges. I just wanted to make sure we keep that in the conversation as well. Thank you.
Thank you, Brett. Okay, so yeah, I don't think we have too much time for comments unless someone had like a 10-second comment on that. I do want to make sure that we have time to take a bio break because I know we have a long day today. If that's okay with everyone.
I would just say very, very quickly in response to that one of the good things about HPI is that it encourages people to change their behaviors over time, gradually, of like their own volition based on the pantry, helping them with nudges, whether it be displays, signs, cooking demos. It's supposed to be the antithesis of like forcing people to do diets or do other kind of fads or things that as Brett mentioned, can be kind of difficult or maybe even come off as condescending or challenging to people.
Yeah, thanks,
yes,
Gio.
I just want to say, that above all, what we do has to have compassion. And if we just hand people a bag of food without having love and compassion for them, then we're not doing the right thing. And first of all, that we would be understanding that they're struggling and that a little bit of kindness goes a long way. Thank you.